What is coronary artery stenting? Most patients nowadays with severe heart disease would go for angioplasty and stenting rather than bypass surgery. Now, in order to do the coronary angioplasty and stenting, the procedure nowadays called PCI, the doctor has to introduce wires, balloon, stents, and other instruments from usually the wrist nowadays, or sometimes from the groin to the femoral artery. This has to pass through the aorta, the biggest artery in the body, before they can be negotiated into the small coronary arteries, which start from the base of the aorta. Now, coronary arteries that are diseased and blocked are not plastic tubing or rubber pipes that can just be opened. In order to open the narrow segment, which can be quite hard, the doctor has to introduce a balloon and exert high pressures, usually 5 to 8 atmospheres, so as to break the wall that can then be distended. So when we repeat the X-ray angiogram for this, it might look good, but if you have a chance to look inside the coronary artery after balloon angioplasty, you're bound to find that there will be a lot of damage to the wall, cracks, breaks, and so on. Now, sometimes the damage can be more severe and more extensive compared to the original narrow segment. I remember during my training years in the United Kingdom, at the time there was only balloon angioplasty, there were no stents available yet. Sometimes patients develop such severe damage, a condition called dissection, that they need to come for emergency bypass operation. It was quite a common procedure. For fear, if not done, the patient can develop heart attack and suddenly collapse in the middle of the night. Subsequently, stents were invented, so these would be placed inside the opened damaged section of the coronary artery. At least the stent to keep the artery open, the risk of sudden closing is reduced. But what are stents? Stents are usually metallic implants that are inserted and placed in our small coronary arteries. They are foreign bodies from outside our body. So, and the blood is constantly in contact with this foreign body. So two things can happen, two dangers. The first is when blood comes into contact with any foreign body, the tendency is for it to clot. And this is our body's protective mechanism, so that, say, we cut a hand, the blood would clot to seal off the leak. Otherwise, you could die from a small cut on your hand. So there's always a danger of blood clot forming on the stent. And because of this, usually patients are given very strong blood thinning medication. In fact, before going for the procedure, they are already loaded up with blood thinning medication for fear of sudden closure from the clotting that forms on the stent. Now, when the foreign body is included in the body would try to seal it off. So cells will be deposited on the surface of the stent. This is part of the healing process. And because the stent is a complex structure, a lot of cells will be necessary to cover it. And in the process, there can be narrowing of the artery again. So these are the two dangers that anybody with stents inside the coronary arteries can face. Or you might say that coronary occurs, the doctor can always do it again. True, but this only applies to the lucky one who have the chance to go to hospital, to see the doctor, and to have repeat angiography. Sometimes things happen very suddenly. So somebody could be out walking, shopping, playing golf, and so on, away from civilization even, and a sudden heart attack occurs, and in some cases, with the sudden heart attack, the patient would collapse. And you can try to resuscitate using CPR and automatic defibrillator and so on. The success rate is not marvelous. And this is one reason why, when we compare patients who undergo bypass surgery with stenting, more patients who have undergone bypass surgery survive, even for a medium-term period of 4 to 5 years. You can see the difference already. That is, that there is a survival advantage in patients who undergo bypass surgery compared to those who undergo angioplasty and stenting. Thus, for patients with severe coronary artery disease requiring treatment, I believe that for short and the long term, bypass surgery